Hello everybody, this is Dr. Patrick Nemechek. I want to talk a little bit about losing eye contact. All right, now losing eye contact, think of this differently as no eye contact. Like when your kid's deep into autism, he's not really responding at all, he can't really fix his gaze on anything, he is almost like in a stupor. And that's basically what the propionic acid does to the kids, is they're drugged in essence. No matter what, you're like, Bobby, over here, come on. You just can't get them to really to look at you or stay fixed on you. Now, when you start the protocol, what happens is either with inulin or rifaximin, you get the separation of the birds and the fish, right? And then you quit making propionic acid. You kind of get this awakening where now they're alert and they're paying attention. And things are going along really well. They're getting all these developmental gains and things are starting to make sense. At first, when they, in that awakening, they're focused on you. And that's really because for the first time in a long time, they can connect, all right? I can't imagine. It's like they've been freed from a prison. Now, you go along 6 months, 12 months, 18 months, and it seems like he's not looking at you much anymore. Like you're losing eye contact. That's really not what's going on here. What tends to happen more commonly is he's just not that into you anymore. He's maturing. He's able to stay focused on other things. He now has his own interests. And you're like, Bobby. And remember the old cookie test, all right? You can get Bobby's attention if you try to ask him about something that he really likes. You're like, Bobby. He's not paying attention. And the minute you go, Bobby, you want a cookie? Boom. He'll look right at you. Or do you want your iPad or play on the trampoline, whatever that favorite thing is. Boom. Okay? That's different. That's not regression. In some ways, it's like a typical kid at some age needing to learn to pay attention to their parents. Okay? So you have to differentiate as your kid's progressing and them not looking at you all the time when you want them to. Differentiate that from actually propionic acid, lack of eye contact. Now, you can have propionic acid, lack of contact, eye contact later, say a year, 2 years, and you end up with inulin failure, and boom, you get overgrowth again. You got now the fish up with the birds. You're making a bunch of propionic acid. And remember, this is like a sedative. Now you can have that kind of just general poor response time, okay? But it tends to be for everything, even the cookie. All right? So don't panic. You're a year, 2 out, things are going good, but he doesn't seem to respond to you as quickly as you would like. Remember to try the cookie test. Just, something that he enjoys, trampoline or the bicycle or the iPad or something, and boom, you get a quick response. It's not a regression. It's not a relapse, okay? It's just you're in this phase where he has to learn to basically listen to his parents when they're calling his name. And that still could take another year or two. I mean, we don't know developmentally all the process it takes for that to happen. So I hope that helps for you. Remember, not all lack of attention is lack of eye contact. Sometimes they just aren't that into you at the moment. All right? Okay, everybody, take it easy. It's Dr. Nemechek from Buckeye, Arizona. Take care now. Bye-bye.